What's good, y'all? Today I am super excited to have my brother on. Yeah, my brother on because he's going to provide so much information, or at least just enough information that's going to allow you to become him. No, but seriously, as you know, we're trying to make sure that you know exactly what it looks like to maneuver into one's position. That's the one that you're witnessing today, which is Kevin Wilson. And I want you all today to pay close attention to the details and the way that he actually was able to achieve his goal, because recognize he did it the non-traditional route. He did a lot of stuff traditional and some things weren't. And for that reason, you need to pay attention, because you can realize that even right now, you can maybe go ahead and achieve something that you want to do, especially if it's something similar to his position, or if you're this person that is going through whatever and did not know what you wanted to do. And today you figured it out. So I look forward to this conversation. I think that you're going to get a lot from it. I'm going to get a lot from it, which is why I always enjoy these things personally. And with that, man, what's good, bro?
What's going on, Mario? Appreciate this opportunity for sure. I want to share a lot of information. I love my profession, so any insight I can give to help others who are interested in the same thing that I do, I'm welcome to provide. So I think it'll be good here. So, looking forward to it.
So that makes life so much easier, because the first number one question, and I swear, y'all, I did not give him the heads up at all. And I know you all have been watching these interviews, but today is December 5th?
December 6th.
December 6th. And it's Sunday at 8 in the morning. Y'all don't know what time these interviews happen. These interviews happen usually at night. So to wake up and do this interview was not desirable on a Sunday for me, but I did it for y'all.
It'll be worth it. It'll be worth it.
The point is, I don't remember what the point was. I forgot. It's 8 o'clock in the morning, and we're going to get to it. So I just want y'all, that's what it was. Long story short, I didn't prime him. And the first question why I've said all this, man, is because every single interview, as you would have seen by now, in the real time frame, not today's time frame, is, do you love your job? And you went straight to that. Like, that's the number one required question that has to be asked in order to be able to do these interviews. And you answered that. And so we don't have to do that. So the first question I do have for you today is, what was the first profession that you remember wanting to have as a youth?
Wow, that's a good question. First profession, I have a vague memory of wanting to be a firefighter. I think that's like long ago. We're talking maybe 10, 11 years old. I can vaguely remember thinking that was just a cool job. I would say once I got to high school, though, I started thinking about psychology. And so that's honestly somewhat far off from what I actually do to a degree, but just the thought of kind of working with people, helping them through their problems and really analyzing the mind was intriguing to me. But I would say those were the first professions. And it wasn't until my senior year of high school, maybe even my freshman year of college, where I got serious about the profession that I have right now. So
yeah. Okay. It's interesting. I could actually see you as a firefighter. You got the height, you got the strength, and I don't think you've had as many injuries as I have and Leslie. So for that reason, I think you might be really healthy and a good option. What took you off that path?
I think it was just experience. Once it was time to pick a university, I had already been working with my dad for a while at his company. And so honestly, he was pushing me in that direction. It turned out that I wasn't the biggest fan of computer science, which is what he was into. I did respect the fact that he owned his own business, but that kind of led me to professions where I can potentially own my own business one day. And so he kind of introduced me to my current field. I kind of shadowed someone, and that was it for me once I had that experience.
Speak a little bit on that. How did growing up with a parent who had their own business impact you and the way that you've seen becoming a professional because he was the boss.
Right.
And the company was flourishing, was successful, and frankly, is with the times because it's technology. That's just where we're always going to be, is moving in the technology range. And if you're in the technology industry, you're probably up to date. And so to been with the times, to have had a successful business, to be a boss, opposed to, and not just a boss, to be an owner. And that has to affect the psyche of the child who's actually seeing this. So I'm just curious to know, what was that impact? Because it wasn't like your dad was coming home like, I hate my boss.
Right.
Because the customer is the boss.
Right. It would be a problem if that's what he was coming home saying, because, he's speaking to himself. But no, I mean, honestly, I really did enjoy the freedom that him being a owner provided. He never, basically he could set his own hours. So there was never a time where he missed my sporting events. It's like, you know what? My son has a game. I'm gonna leave a little early, head out. And so I did appreciate that freedom that being an owner provided. And so that was definitely appealing to me. And it still is at this point. So.
Okay. So was there anything that you gathered from just witnessing his experiences and whatnot that may allow you to be more informed in your decisions in the future, or may have just prepped you to where you are now?
I would say that looking back, I can tell it was a lot of hard work. As I said, he can come to my events, but there's also times where he would be at the office on the weekend, and times where I would go to the office with him. My sister and I would just be sitting there in his office playing with the copy machine, or, whatever kids do. We find anything to play with while he's actually working and making his vision come to life. And so looking back, I can see that it does take a lot of work. It's worth it, but it's not all fun and games. And so that's one thing I can take from growing up with my dad, for sure.
Okay. So for clarity, everyone out there, I said he's my brother. And so for you to understand what this conversation is and understand, technically, Ken is my stepdad. I say technically, and technically Kevin is my stepbrother. I say technically because I don't believe in half siblings. I don't like this whole idea of step and all that stuff. So that's my brother. And so that's where, when you hear this whole experience, that's what you're hearing, is there is a little bit many years between, because I was 14, I think, when they got married, 14, 15 when they got married. So obviously I came in a little late. He's older, and Leslie, who was one of the first interviews, she is one of the older sisters. So that's the story and why there's some separation in there. So, okay, so we're here. Might as well just get to the point and ask the real question of, what's your actual profession? And do me a favor in explaining what that actually means. Most people actually knows what your profession means, but if there's anything that may not be something that the public thinks about, feel free to share that.
So I am a dentist. I've been practicing approaching 3 years now. Like you said, I think a lot of people, hopefully you know what a dentist is. That means you're keeping up on your oral health. And Mario, we're gonna have to talk about that a little bit, but no, for sure. Dentistry, my actual degree is called a doctorate of dental surgery. So that surgery aspect is a part that people don't think about all the time. Maybe so, because we do have, I don't want to call it a drill because that sounds intimidating, but we use instruments in mouth. We do irreversible treatment to teeth, so we can take away structure that can't be returned. So yeah, I mean, my basic job is to keep people's oral cavity healthy and also to get people out of pain. And so yes, dentistry is my profession.
That's interesting. So wait. The title that you said, it was dental surgeon?
Doctorate of dental surgery, yes.
Okay, so is that normal,
Yes.
or is that specifically yours?
That's normal. So if you hear people say they have a DDS degree, that's what that stands for, just the Doctorate of Dental Surgery.
Okay, okay. And the surgery is referring to, say, cavities and things like that, not the
So,
actual, like, did I get my root canal from my dentist? You,
probably, yeah.
but not the crowns.
The crowns you also got from your dentist, yes.
Nah, my dentist didn't do crown. Yes, he did. I take that
Yeah.
back. My dentist, I'm thinking because every time I have serious, obviously I have serious issues at times with my teeth. They always send me off to some specialist to take care of. Oh,
Right.
he ripped this dude. I still got pain in my face. I'm gonna be honest with y'all. This. I don't know if he's a dentist or whatever. He snatched my tooth out of my face. Like it was this old dentist. I don't even know how he had the strength to do this. He must got the freaking forearms that could loosen a boat on a tire. Like I swear, this guy got on there, practically put his foot on my chest and just cracked that thing out of my face and ripped it out. It was around this time last year, actually. And my face still freaking hurts right here to this day. I need to figure out what's going on there. They said nothing's wrong, but that's a different kind. So, man, tell me about that. What's your experience? Because everyone, of course, as we talked about it, most people know what a dentist is. Just like most people know what a doctor is. At least if you go to ER, what type of doctor that is. So, what's something that we don't know or we don't think about when it comes to the dentist's profession?
Maybe how diverse the profession is as far as the different specialties that you could get into. So you kind of hinted at, your dentist maybe not doing crowns. While most general dentists do crowns, there's a lot of things that some dentists don't do. For instance, you mentioned root canals. You may have heard of this term endodontist before. So that's a specialty of dentistry. And so some dentists decide, you know what? All I want to do is root canals and things related to the roots of the teeth for the rest of my life. And so you may have been sent to an endodontist to do that root canal. And that's why you're having memories of different dentists doing treatment on you. Some dentists may only want to do surgeries where they're removing teeth. So that would be more so up the field of oral surgery. And so there's a lot of different subdivisions, actually 9 in total. Braces, for instance, you go to an orthodontist. So a lot of people, experience that. So I would say that that's one thing in dentistry. There's a lot of subdivisions. And if you love one thing, you can go in that direction and just concentrate on that.
Okay. So that makes sense. Because now that you brought those in there, obviously I've had a lot of stuff done. So the memories are coming back. So I've had all of my wisdom teeth taken out. I had that tooth taken out, and I've had several root canals, and all of those were by, I guess, endodontist, and some other surgeons as well. And now I'm curious because that was the one part that threw me off when he did remove my tooth. Is when I got my not my root canals, but when I got my wisdom teeth taken out, that required me to get put under. I was put to sleep and he did it. I woke up at home. I remember going in and out, the strong drugs. So I was present and woke, but not for real. Why did I have to be woke? Why did I need to be awake? Sorry about that. Why did I need to be awake for the tooth extraction opposed to the other tooth extractions?
It just depends on the difficulty of the surgery and the location. So when you're removing wisdom teeth, they're very far back. And a lot of times those wisdom teeth, believe it or not, may still be covered by bone in your mouth. So you look in your mouth and you can see all of your teeth. Sometimes wisdom teeth are impacted, so they're stuck underneath your bone. And so the surgeon needs to go in there, remove some of the bone, and that's just very invasive. A lot of times it's better for the patient, for your overall comfort and just the ease and not having to worry about movement is just easier for everyone. If you're asleep, you wake up, teeth are gone, and you're good to go.
That makes sense because, yeah, I actually did have impacted wisdom teeth. I think that was what allowed my insurance when I was in college to cover that. So that's interesting. I mean, we all, and so part of what we do, we always ask some of the general questions related to the profession as well as just general questions people have. Why do we have wisdom teeth if they're always going to get taken out and they're going to cause pain? Like that doesn't make sense.
You know what?
Like,
It's kind of interesting, at least to me, but I am a dentist. It's really part of evolution and how humans are changing over the years. So if you look at man from years and years and years ago, we used to have more teeth in our mouth. Our jaws used to be bigger. And because our jaws were bigger, we had room for more teeth. And so as the years go by, evolution, our jaws aren't as large. And so we don't have enough space for those teeth anymore. But I guess it's taking the teeth longer to realize, look, I don't need to be developed. So we're still getting those teeth. There's just not enough space for them. And so they become impacted or there's not room for them to erupt into the mouth. And so it's really just from the past. People used to have more teeth in their mouth. We don't have as many teeth anymore. And so all of us are getting those wisdom teeth ripped out of our mouth.
so
Most people do. Yeah.
yeah. But that's the other part. If we're honest, whether it's technology, whether it's dentistry or the different medical doctors out there, you all frankly are a luxury. If we weren't living in a civilization like we live in, we may not have access to a dentist.
That's very
So
true.
in that situation, do I just eat it? Like, and then all of a sudden the pain goes away? Like, what would happen if I did not have access to you all like I did when I was in college?
I mean, humans are very strong. We're able to endure a lot. So after a while, we just learn to cope with it. Now, will it affect our life? Maybe will we walk around with a frown more often because of that pain? Possibly, but you adapt and you say, you know what? This is my life. Got to keep moving forward. And so, yeah, we are blessed in this country, especially to have access to care. As much debate as we have over the healthcare system, like we are blessed in that sense that we can get those things treated in most cases.
Huh. You said it, so you triggered me to ask this question. I've been to a country in my life, and that country didn't necessarily take care of the doctors and anybody in special positions in a lucrative way.
Hmm.
That they were more equal to everyone else, and not to say that you all aren't equal, but just saying that you all, frankly, are historically known to get paid more than the average person. And so I'm just curious to know what happens if we were living in a country, say like Canada or some of those European countries that have universal health care. And what happens to because I mean, at the end of the day, we're in a country that people are constantly having this conversation. So if we did have universal health care and health care taken care of by the government, how are you impacted financially? Or what happens to your profession in general if the finance responsibility gets shifted?
Um, I mean, this is just my opinion. I don't know all the ins and outs of it, but I would imagine that the pay would go down to a degree, but I don't see it going down a significant amount. And it's because these medical professions are still valuable and necessary. And I think most governments are aware of that, and you need to attract great minds and great people into those professions. And so there would still be some financial incentive to go that route. Will some people be turned away because of a pay cut? Potentially, but there's definitely other rewards that you get from my profession and just medical professions in general. And so, yeah, I think once you start having government involved in healthcare or other areas of life, the salary does go down, but that may be across the board. So it still would be appealing if you're only after the money to enter dentistry or a medical profession, because it still may be higher than another career that you could choose. That's just my thinking to it. And honestly, I think the benefit of everyone having access to care outweighs any type of pay cut or whatever changes may occur there. But that's just me personally.
So now you got me curious. I got to ask then. I mean, they all are wondering, which is, so what triggered you to become a dentist? What interested you in this industry?
Honestly, it did start with my dad owning his own business. That's the one part of his profession that I did like. The part that I didn't like was sitting in front of a computer screen all day. I wanted to interact with people more. I wanted to work with my hands more. And that was one of the things. Like, once I was introduced to dentistry and I got to shadow a dentist, I saw, like, wait, this guy owns his own practice. He is working with his hands literally every day. He has different patients coming in and out of his office. And that just hit everything that I was looking for. And I was like, you know what, I'm gonna give this some serious thought. And that's when I headed down that path. So for me, it was that the working with people, working with your hands, the potential to own your own business, that kind of led me down the road of dentistry.
So what age was that?
That was, if I had to guess, maybe 18, 19, probably around that age. So it was, in my opinion, that's kind of later in the game as far as, choosing what career I wanted to pursue.
Really?
I think so.
It's people that get jobs right now that don't know what they want to do.
You're right. That's true. I'll take that back. You're right about that.
So were you shadowing him or her? Were you shadowing the dentist? Or was this an appointment that you had? Because most people you're not just in a dentist office. That doesn't just happen. So how did you get that exposure to realize that, oh, this is this person's business? This is pretty cool. Was this a mentor? Like, yeah. So
you bring up the mentor. I think that's very important. It's not the only way to get to where you want to go, but having a mentor, someone to guide you, someone to basically give you opportunities that you would have no idea about is very beneficial. And for me, it did happen to be my dad. He was the one who introduced me to this dentist, and at that point, he set up the arrangement, and I got to go into the office and kind of follow him around. The dentist that I'm thinking of, he also had a wife who was a dentist, so I actually shadowed her some as well. And so it was just a great opportunity for me to be able to ask more questions of them and just, find out what that profession was really about. And so I would say, if you didn't have someone with those connections, it sounds crazy, but just walking into an office and letting someone know that you're truly interested in this, if a dentist or someone sees that honest interest, most people are going to try to feed that and say, you know what, like, I want to let this person know what my industry is about. And so you can find opportunities like that. And so once you get to college, there's other programs as well that can, kind of give you information or give you contacts for shadowing a dentist. And so yeah, I mean, for me, it was just my dad introducing me to a dentist that I was able to shadow.
Okay. So you were 18.
Mm-hmm.
Well, you said between 18 and 19. Were you in college at this time? Was this like a summer break that you came home? And you said you were late. So were you already in school at the Mecca and learning, or was this prior to? Like, what's the story behind there?
I'm trying to figure out the timeline. I know it was after I was already applying to undergrad schools, because at the time, one of the schools I applied to was Carnegie Mellon, and that was a school that was known to be very big into computer science. And like I said, that's what my dad was doing. Because I didn't choose a profession yet, I was like, okay, let me, potentially go down that route. And so I got accepted into several universities. Carnegie Mellon was one I did not get accepted to, ironically, but so it was definitely sometime after I was already accepted in college. I just don't remember if I started attending Howard University, where I went for undergrad, or if it was after I had already, or beforehand, I should say. So yeah, I know it was around that time, my freshman year of college versus my senior year, the end of my senior year of high school.
Okay, so what triggered? You went to the Mecca. What triggered that? Like, why did you go to Howard?
Good question. Now, I did play sports in high school. My biggest sport was baseball, and I'll be honest, I got a scholarship to Howard, and that was a big driving force. I wouldn't consider myself the greatest baseball player in the world, and so that was one school where I was able to play on a collegiate level, and so that was probably the biggest influence. Now, there were a lot of perks that came along with going to Howard. Seeing a lot of African American, just a lot of bright young African American students was amazing. I'm not going to lie, but baseball was really what brought me to Howard personally.
Wow. Okay.
Surprisingly, you wouldn't think that, but
yeah,
they don't even have a baseball program anymore, which is sad. But
yeah, I knew that you went there and played baseball, but I didn't equate that because it's like somebody that gets recruited to play football for Yale. Did you really go there for football? Like,
right.
or did you go there for Yale? And I only use that example because true story. My first letter that I received from any university was from Yale.
Nice.
It was a football recruiting letter, or at least a letter of interest or whatever. And I remember I got one, and one of my friends, he got one from Harvard. And unfortunately, due to us originally growing up in Cleveland, in areas where they told us that your A is a C in their schools. So there's not a chance you're going to make it in. There's not a chance. So we didn't even pursue it in hindsight. It's like, man, I absolutely could have graduated from that university.
Yeah.
I absolutely could have handled the rigor. It wouldn't have been more than me just having to overcome something else. Like, it's nothing new to me, and I could have did it. But and I don't even want to say that this whoever's looking at that letter and thinking, let's check this out. Don't give it a chance. Because
I agree.
Yeah, I put the no in there and didn't allow them to tell me no. So speak about the significance of Howard, because there's going to be an audience that's going to be watching this that are going to be looking forward to try to go to college and university and figure out what university that should be. And I know how significant that school has been for the community and just in success for Black folks across the country. And the world. I don't want to take that apart. And in the world.
I'll say this is something about seeing a group of African Americans achieve or aspiring for success. And that's everywhere around you, your classmates, even the professors are usually African American. And for a lot of people throughout the country, you don't always have that growing up. Now, some people, they went to schools with all, most Black students, but that's not everyone's experience. And so when you see almost those people in professor positions and just administration are mostly African American, is just inspiring, and it helps you to push to be great as well. You don't want to almost let your race down, as crazy as that sounds. I know we can't put all of that on our back, but it's just nice to see that collection of African Americans achieving, and the media doesn't always portray that. They like to portray a lot of negative sides of our race, which is a complete lie. But having going through that and seeing other great minds, I mean, look at our vice president now. So that's just one example of someone who came from Howard. And so, and it's kind of crazy because I feel like outside of our our community, no one, I mean, I say Howard, and I think most of the time people think I'm saying Harvard. Like saying the word Howard doesn't connect with a lot of people. But I mean, over time, I'm hoping that that can change. I mean, I went there and it definitely was a key to me achieving my profession. And so,
I mean, yes, you're right. When a lot of times when you hear Howard, you may think Harvard, and I think I haven't looked deep into the actual academic scale and the rankings at Howard, but I've always actually seen it as the HBCU Harvard. Like I've always seen it in my eyes as pretty much that. So I'm like, yeah, that sounds about right. And also understand what you're saying by not want to let the race down. It isn't that abnormal. It's just the fact that when it comes to Black folk, we don't talk about that frequently, unfortunately, because it's always this trying to survive. And in fact, around the world, it's your duty. I mean, as an American, you need to do your duty as in the society to contribute and make a difference. And in other countries, it is your duty to produce certain types of professions so your country can flourish. I mean, it's not abnormal, and it makes absolute sense, especially when you have pride. And I will say, as an adult, I absolutely would have loved to have attended a HBCU grad program. Um, I chose to go to HWCU for several reasons. First off, they were the biggest name, as well as the biggest name that was recruiting me, as well as the financial part, the attention. I hope to play football in college outside of the fractured spine. And so I was hoping to get recruited, and I seen that as the easier route. But I also went to majority Black schools my whole life. And so I never was able to actually, as many tours as I went and how many recruiting experiences I've had, none of them were at HBCU. So I didn't know or was even ready to take in what I would have seen in the excellence that was at those universities. And I didn't realize, I think it was going into junior year, and I visited my cousin Quincy in Tuskegee. Boy, I walked on that campus and I was like, oh, this is different. This is different. This is amazing. And all I could think was, thank God I didn't come here. I would have failed out because I would not been able to focus at this university. There's so much excellence here. There's so much to get into and be busy with that has nothing to do with education. And it would have been excellence, but at some point you need to focus on your academics. And that was where I was like, all right, man, I don't think this would have been for me.
Yeah, I mean, there's a lot of fun, a lot of fun to be had at an HBCU as well. But we got to you always have to remember why you're truly there. And if you can get back to that, you can have your fun and get the job done also.
Absolutely. And like I said, young me probably couldn't handle it. This me would have been, man, it would have been motivation, it would have been peace, it would have been a lack of stress. And because when you got to go to school, you got to go to campus. And I remember in grad school, I think I mentioned this in a previous interview, and what my professor asked us and asked the whole class, there was only 3 Black people in there, maybe 2, it was 2 actually in that class, and the rest were all white. And he was like, how often, whoever in here notices their race every time they walk on campus, raise their hand. And of course, there's only 2 Black people. And it's like, to have been able to go onto a campus and to be a person there, like it takes away a significant amount of stress. And I can only imagine that on that level, it only would breathe excellence, in my opinion, because you're able to focus on excelling in your academics opposed to being the exception at your university.
It's true. That's very true. Having that switch from going to an HBCU to a traditional college, even for dental school, and I actually got my master's also. It is different. It is something that plays on your mind when there's only, 3 other Black classmates, and whether your other classmates are thinking it or not, it is something that plays on your mind. And that does take away your focus to some degree. And so just being in that environment at Howard, like you said, where that's not an issue, it changes things. It just feels different. So
Yeah.
I don't know. I wouldn't take that experience back for the world, honestly. I'm so happy I went to Howard.
And you're one of the statistics. They say that HBCUs are the number one source for producing Black doctors, like doctorates, better yet. Black doctorates come and oftentimes graduate from HBCU at a higher rate than anywhere else, period, in this country. So that's pretty dope. So just break down your actual path. How did you become an actual dentist? Like what was the process in that?
That's a long story, Mario. So
All right. As I've heard many times, make a long story short.
All right, let's do that. I would say for me, it was first getting accepted into undergrad. That's key. That's probably the easiest step. Then it's while you're in undergrad. Like I said, around 18, 19 is when I decided I wanted to be a dentist. That's when you need to know what is required to get into dental school. That's key. So I would say the
At 18?
earliest. I'm sorry, what was that?
At 18, you have to know that?
No, I'm saying if you do know at 18, 19, honestly, if you know earlier than that, the better. Reason being, I'll kind of explain that. Let's say, I think the average GPA to get into dental school right now is a 3.55. And we have something we need to take called a DAT. It's just an entrance exam. The average score you need for that is around a 21. And so if I get to my junior year, the middle of my junior year, and then I'm like, you know what, maybe I do want to go to dentistry, but I haven't been preparing, I haven't been keeping my GPA up, it'll be that much harder to get into dental school. I'm not saying it's impossible, but the earlier you know this is the route you want to pursue, the more you can keep your grades up and either shadow, do other things that make you appealing to these dental schools. Because I think that's the hardest step in this whole process, is literally getting accepted into the dental school. Once you're in dental school, it is hard, but I think if you get in, the likelihood of you finishing is pretty high. And so, yeah, I think that, yeah, that's all I was saying as far as knowing earlier rather than later. So my path was, I actually got into dental school right after undergrad. And I'll be honest, just with my personal habits, as far as just everything, just like studying, I was lucky where in undergrad and high school, I got great grades without trying much. And that's, I'm just being honest, and I'm not that anymore, but that's what it was. And when it was time to go to dental school, I realized early on that I didn't develop the habits that were needed to make it through dental school. So my first time in dental school, I actually left. I left dental school. I ended up entering into a master's program, and I was a teacher. I got my master's in anatomy, and I taught for several years. It was in that master's program that I learned the amount of effort that it took to make it through dental school. And then I went back later on in life, much more prepared. And I definitely excelled my once I went back to dental school. But I realized, because school came so easy to me in my early life, that I didn't develop those, you need to sit down and study X amount of hours a day. I didn't have that in me, and I wasn't mature enough at the time. And so I thankfully, I had my second opportunity, and I went through dental school. So.
All right, so let's take some steps back. First off, what was the actual major in college?
So I majored in chemistry. in
Chemistry.
college. Yeah. And so if you're going into dentistry, I would recommend majoring in one of the sciences, whether it's biology, chemistry, something in that realm, because all the exams that you're taking are going to focus on that. So if you're already in those classes, it just helps. Now, if you have a side interest, that's fine, but you're going to have to take all of those science classes anyway. So majoring in one of those fields helps a lot.
What am I missing that chemistry is so significant for becoming a dentist? Like as a foundation.
It's not. I'll be honest. Now, one thing I mentioned that DAT earlier, the DAT exam has an organic chemistry section. So strictly for that, you need chemistry. I cannot say there's been a day in my career where I've used that chemistry knowledge, but it's part of the game. It's what they test. Now, I would say organic chemistry is a lot of memorization, so maybe they want to test that skill for whatever reason. But I would say biology. Now, having a foundation in biology, how the body works, that is important for dentistry. Even anatomy is important for dentistry, and those are requirements for getting into dental school as well.
Okay. Okay. So let's stay in college. In college, you know by 19 that you want to become a dentist. What are you doing? Are you in any programs, any organizations? Are you shadowing, interning while you're in college to develop that muscle and that skill?
Yeah, so while I was in undergrad, I did shadow another dentist. He was actually maybe 2 blocks up the road from Howard University. And so I would go to his office and just watch him do procedures. Also, we had a pre-dental society at school. And so I was a part of that as well. They would have dentists come and speak to us and just gave us other opportunities. And then there was another program that I did one summer at Columbia University, actually. It was for students who were interested in either doing medical school or dental school. And so I spent an entire summer in New York also, and that was a great experience. But those are some of the things that I did while in undergrad to help me prepare for dental school, dental school.
How much did that help? Like, I know you probably put it on your resume. So, how much did that help in getting references as well as just being able to say you have certain experience?
That was huge. Now, I will say the Columbia University, just that name holds a lot of weight. So I would be lying if I don't think that helped my chances of getting into dental school. And so that's another key point. I think the biggest thing, if you're interested in going into dentistry, is your grades. Just being honest, just getting your GPA as high as possible. The second most important thing is your extracurricular activities, just being able to show the dental school that you actually shadow a dentist. Now, they require it now. I think it's as high as, it wasn't this at the time where I went, but you're required to shadow for 100 hours before you can even apply to dental school. And I think it's just they want to make sure this is something that a student actually wants to do. So those extracurricular activities are huge if this is what you want to do.
What does shadowing look like? Because I'm thinking apprenticeship to some degree, but I would assume because you're not licensed with anything, you're probably not really hands-on.
Right.
So what does that actually look like?
So it looks like spending an entire day at a dental office. So you go in, a lot of times the dentist will have patients. And so often the dentist will ask the patient, are you comfortable? I have someone interested in this profession. I would love for him to see what we do. Would you mind if he watches this procedure? And I've never once heard a patient say, no, I don't want this person in the room. And so you get to see firsthand what the dentist does. And so you do that maybe 3 days a week. And when you have the breaks, you get to talk to the dentist one-on-one. He'll give you insight or she'll give you insight. So yeah, it's literally following the dentist around for a day, and you can actually see what the day-to-day operations look like as a dentist.
Okay. And so you're just following. You're not helping with anything. Like you're not doing any work.
You every once in a while, but nothing. I mean, there's only certain, you're not legally allowed to do, too much. But I mean, if you can help clean a room or something like that, you'll do little things like that.
Okay. Okay. So that clearly isn't paid at all.
Oh, not at all. Not at all.
Or else that'd be the most cushiest opportunity of all time right there.
Right.
I just got to walk around and look at them. Okay. All
No,
right.
no. Sorry. You don't get paid for that. That's just paying your dues.
Do you get paid for anything in preparation? Because I don't hear any paid internship opportunities in here, at least for your field right now.
No, I will say right now where I'm working, I do have a dental assistant who's aspiring to be a dentist, and he just applied to about 8 schools this past semester. And so he has the best of both worlds because he is getting paid and he's getting that firsthand experience. So, that is a route as well. Consider being a dental assistant. I would be surprised if dental schools didn't find that appealing, that you are willing to be right next to this profession for several years before applying.
And that will suffice over having to shadow somebody?
It depends. You'll have to check every university. Some universities will specifically say it cannot be a paid position, which I don't necessarily understand that aspect of it. But check with each individual school. Some say they don't want it to be a paid role.
That seems particular.
The only reason I can think of is that they want to make sure you're doing it because you love it, not because you're getting paid. That's the only thing that I can reason.
What is that about? Like this is like your second or third time repeating the idea of even a DAT entrance exam. Like at the end of the day, what is it your business if I actually love this thing or if I want to do it for money? Like if I'm good at it and I want to do it for money, why do you care that much about whether or not I actually like it? So why do you keep bringing that up? Is that important? Because it seems like it is.
I think that's important with any profession, if I'm honest.
Yeah, but you're highlighting this.
You said what?
I said, yeah, it is, but you're highlighting this as if like it's a requirement in the industry or it's an industry.
No, it's not at all. It's not specific to dentistry at all. Yeah, I just think if you're doing anything for money that's not going to last that well. I was broke for a lot of years. I'm not broke anymore, and I can definitely say, it's cliche. Money doesn't bring happiness. That's 100% true. It makes things. It allows you some freedoms for sure, but I wouldn't stay in a profession strictly for the money.
Yeah. I also understand the idea that money doesn't bring happiness. I also heard a very fair response to that as well, which is let me find out for myself. Right. Money don't bring happiness, but give me some so I can find out if that's true.
Everything being equal, just take the role with the most money. I will say that. I'm not going to steer anybody away from that.
All right, so we know that you did these things in college. Was there anything that you haven't mentioned prior to graduating college that you did that assisted you in getting this position and even getting into grad school?
I think it's the same thing in high school to a lesser degree. For instance, when you're applying to undergraduate schools, they also want a certain level of GPA. They also want certain extracurricular activities. And so I did, like I mentioned, I played sports. I was in this mentoring program while in high school as well, where I was a junior, senior, and I would help freshmen and sophomores who were struggling, kind of tutor and so forth. And colleges love that. So it's all about making yourself appealing and making yourself stand out to these universities that you're trying to get accepted to. It's just a little easier to get accepted into undergrad. Not easy, but just easier than getting accepted into any professional program. So,
Okay.
same thing. Extracurricular activities, huge. Keeping your GPA up, huge.
What was that gap? How long was the gap between graduating from undergrad and going into graduate school for dentistry?
So, for me, it was quite significant. I got my master's in between dental school.
Master's in what?
In anatomy. So a master's in anatomy. Dental school was probably talking maybe like a 10-year gap for me. So I'm not traditional like you hinted at earlier. And so that's huge. I want that to be motivation for people as well. It's never too late. There are times where I felt like I was too old to go back, but no, you're not. So if it's something you truly want to do, you can still make it happen.
Did you expect to go back? Because I'm trying to now, once again, I'm piecing your degrees together. You just said anatomy, and it was chemistry, anatomy.
I did. Like I said, oh, sorry. Like I said, when I was 18, 19, I kind of knew that dentistry is what I wanted to do. And so even with that, getting my master's in anatomy and teaching, in the back of my head, I without question said, you know what, this can help me in dental school. Like that was 100% a thought of mine. Even when I taught, I had the opportunity to teach people who wanted to be dental assistants. I taught them dental anatomy. And so that was something else that I was able to put on my resume as well. I literally taught dental assistant students in dental anatomy and so forth. So yeah, I mean, I kind of knew all along.
Okay. Because that's what I was going to ask is what's the significance of an anatomy degree, but you said dental anatomy. So an anatomy degree is covering the entire body in depth.
True.
To the level that you even went into understanding dental.
Yes.
Okay.
Yep.
Is that normal? Or I mean, what I would have thought there would have been an actual degree specifically focused on getting your DDS.
In undergrad, there isn't. Sometimes some universities have something called a pre-dental program. So you'll do a lot of the sciences and focus to get into dental school, but your degree is not going to say, bachelor's of science in dentistry. There's nothing like that. So it's always bachelor of science in chemistry, bachelor of science in biology or anatomy, but no dentistry bachelor of science degree.
What about masters though?
No master's of science in dentistry also.
All right, so how many years are we talking? Because it sounds like you didn't even have to get your anatomy degree. It sounds like you could have.
No, I didn't have to.
Okay.
So the minimum amount of years that it requires to be a dentist is 8. So you have 4 years of undergrad and then 4 years of dental school. Now, earlier we talked about the specialties such as orthodontists who do braces, endodontists who do root canals, oral surgeons who do jaw surgeries and removing wisdom teeth, for instance. Those require additional years. So you have the 8 minimum, and then it could be anywhere from 2 additional years to 6 additional years on top of that. So it's a long commitment for sure. So I don't want that to scare anybody. The payoff is worth it, but there's a lot of years of education that you have to be ready to put in.
What title is requiring you to do 14 years of school? Because you said you do four, and then maybe another 6. So I'm like, wait, how do we just? That's a big leap, man.
So you have an OMFS degree, oral maxillofacial surgery. So that would be a degree that can require 6 additional years of school. A lot of times they'll not only be a dentist, but they'll be a MD as well. And so that's the additional years that it would require.
What are they doing different? Like, what are they doing?
So they can do things like reconstructive jaw surgeries. They're literally splitting jaws in half, piecing them back together. If you have people who are born with a cleft lip, for instance, they can do those type of surgeries. And so that's the OMFS. That's the one that takes the most additional years.
Huh. I mean, I guess that makes sense. I never thought about it like that. I mean, for me, I think cleft lip, I think facial surgery. I just think of plastic surgery or whatever, and just how many people are doing stuff like that. So I would have never have equated that to needing a dental degree or anything like that. Well, it makes sense. It's in your face. Your teeth are right there, and it's probably doing more than I know is going on above, beyond just the surface level stuff. Okay. So you said 10 years. So you graduated. How long did it take you to get your master's?
It was a 2-year program.
2 years. So now we're at 6. And then you went and got your.
So how long I taught for several years. I'm sorry, what was that?
How long till you went back to school?
Probably, I think I taught for 3 years prior to going back to school.
Okay. So the 10 years is from graduating undergrad all the way to graduating your actual doctor.
In a sense, it may have been some other years that were included. I have to break down an entire timetable for you, but no, it probably is a little more than 10 when I actually graduated.
Okay. So what's one of the big misconceptions or things that people don't know about dentistry and being a dentist?
Wow. One of them I hinted at earlier, that there's a lot of different specialties. And when I mentioned those specialties, I'm a general dentist, so I'm not specialized. Because I'm not specialized, I have the freedom, if I choose to do every single one of those specialties. So if I wanted to put braces on a patient's mouth, I can do that. If I wanted to remove wisdom teeth, I can do that. Now, with that comes some liability, in the sense, because I don't have that degree. If I'm not properly trained and something goes wrong, that falls on me, in a sense. So we have something called continuing education in dentistry, where every 1 to 2 years we're required to do more studying and to learn more about the field of dentistry, because it's always changing. The dentistry that was done 30 years ago is not the same dentistry that's done today. So we're required, in order to keep our license, to continue to learn. So that can give patients some comfort if you realize, like, okay, like, he's still learning. If he wasn't still learning, they would have taken his license away. So that's one thing. Just speaking from, the African American perspective briefly, there's only a little over 6,000 African American dentists in the country. And for me, that seems pretty low. And so it's an amazing profession. I just want to encourage anyone, if you're on the fence of what you want to do, just give it a chance and see if you love it, see if you like it, for sure. So That's all I got for you on that, Mario.
Okay. I mean, that's really interesting. I don't want to drag it on, but the part that got my attention was the fact that you can do this, but you also are in a tougher situation because you're not a specialist who's doing this. And also the part of staying educated, and I'm guessing the educated isn't about the face. I'm guessing it's more about the technology that you're using to continue to do the surgeries and do the work that you do, and what advancements have taken place.
Yeah, it's all about the technology. It's about the different techniques. Things change, so there could be a practice that we thought, and this is with everything. You know how every couple of years we learn something like, oh, eating French fries can cause cancer. It's like things that we used to think back in the day. It always changes, and now we have to adapt and apply new practices. So it's the same thing with dentistry. Our knowledge increases, and so we want to implement different things into our career.
That makes sense. All right, so let's talk some numbers. We get into the end, and everyone wants to know the numbers. So I did my 8 years. I didn't waste no time. I didn't want to beat around the bush. I just wanted to get in, get out. I did my 8 years.
That's the best way to do it.
What's my entry level salary? You graduated from Ohio State. So
Right.
say you stayed in Columbus, what's the entry level salary? And I know where you currently live. So I know those are two different cities, and the finances, I assume, are significantly different because the cost of living in both of those cities are significantly different. So we'll see in a normal city like Columbus, what's the entry level salary?
I would say this is a range, anywhere from entry level 120,000 to 170,000. I would say is probably entry level. Yeah, that'll probably be the average range. Now, I will say I have colleagues who started out at 80,000, and so I would say that's probably like the lowest potentially. But yeah, that's entry level, around that range.
Why would you start off at 80,000?
It just depends on opportunities. I don't think they walked into that thinking that's how much they were going to make, but a lot of times in dentistry, most opportunities you get are paid based on your production, meaning you see this many patients, you take in a percentage of that. So let's say you walked into an opportunity and you didn't realize business was going to be as slow as it was, you don't make as much. Not all contracts are like that, but a lot of dentistry entry level positions are based on the amount of production that you actually do versus having a base set amount no matter what.
Okay, that makes sense. I was going to ask about that because that was where I'm like, you're talking as if a person is required to have a certain amount of clients and you can pay commission. It sounds like it's a little bit commission for many dentists when they first start out, and then it shifts to just the salary base and what you're making, unless you own the business, of course.
Yeah, unless you own the business, that's the variable. Once you get into ownership, the salary, sky's the limit at that point. But yeah, every contract is different. I would say the majority are based on your production regardless, but some businesses will give you a base rate no matter what. So even if not a single patient walked through the door, which is never going to be the reality, but you still get a base amount no matter what.
Okay. What is the path of a dentist? Because I know you can grow in your experience, or you just, once you graduate with the title, outside of maybe the entry level, and I don't even know if there's an entry, if the entry level has a different title. Do you acquire new titles throughout your tenure as a doctor and allow you to gain rank in the industry as well as in a company or whatever?
I would say not necessarily. Once you're a DDS, you're a DDS, meaning the second I graduated, if I wanted to take out a loan, open up my practice day one, you can do that. And then you're an owner. And so there is no higher title than that. It's all about your comfort level. It's about if you feel financially ready to take on that commitment of ownership. But as far as that, let's say you wanted to work for a company, you can be an associate. That just means you're an employee by that company. You'll work on an office. Typically, it may be with another dentist. In certain companies, you then can move up to being the lead dentist. So maybe you don't own it, but you're the only dentist at that location, or you're the head dentist at that location. And then after that, you can partner with practices, or you can be the sole owner. So if we want to get to stages, I would say an associate, lead dentist, partner, then owner would be the stages.
Okay. Okay. So is there, I mean, I just made an assumption, so I guess I should ask, is there a difference in the entry level salary of a dentist in Ohio than it is in your current state?
Um, yeah, they're adjusted for cost of living. I would say so. When I moved from Ohio to where I am now, there definitely was a salary increase.
Okay. Um, how much of an increase is it? Like, what's the difference? Because I mean, for people that are going to be a dentist or go back home to a big city, say a New York, LA, a Chicago, I don't know if there's a Miami. I don't know if that's a big one, but yeah, anybody's going to go back to like a major city or a metropolis like that, what would that price be?
So I would say the price, honestly, more so than the city you live in, is based on how busy you are. Like I said, in dentistry, more times than not, you're getting paid on your production. So if you live in a major city and you're seeing a ton of patients, you're going to make more. Um, if you are in a small town, but you are the owner of the practice,
Hmm.
you're probably going to make more. And so I don't think the city plays as big a role as you would think in the amount that you make. It is more so how many patients you're seeing. Um, and so I would say, sorry, this is kind of a side note, but one thing to consider when you're thinking about ownership, it's always easier to do ownership in a smaller town. There's less competition. Um, Major cities, people, they're very appealing. People want to live there. If you ever driven down a road in a major city, within like a 5 minute block, you'll probably, or 5 minute drive, you'll probably pass like four dental offices. I don't know if you experience that. They're everywhere. And so you always have to consider that as well. So if you want to open up a practice in a major city, just be ready for more competition. You may have to spend more on advertisement and so forth. And so, it's doable, but that's something to consider. If you're willing to live, more so on the outskirts, it increases the ease of success, I would say.
Also, say, well, what just grabbed me is the fact that, especially during this time, we're talking about a world in which people are often looking for Black doctors and Black dentists, And it's not this idea that we just want Black doctors and Black dentists because they're Black. It's because we feel that they may value us on the way that we're just basic humans, like opposed to seeing us in a separate type of way. Because I know, frankly, it's always come back to, unfortunately, when Black women were giving birth, part of the conversation was because they're Black, they can handle pain a lot better than others. The pain tolerance is different, so giving them different medications is different in how it impacts them. I don't know how true those type of things are, but I do know that we want to be treated equally, and sometimes, unfortunately, not all doctors give us that vibe and that feeling as if we matter. And in this world in which we're feeling that and we're able to be proactive and intentional about our dollar, to find a Black dentist, it seems like a very valuable thing, because I have so many friends that are like, you know one, a Black doctor, I want that. I mean, so I would assume that you are a huge commodity in your location. And first off, address that. And the second part is, since you mentioned the small town and the actual traffic being more important to the business and your salary, what is the ideal position for a dentist to make money? Because for me, I would think now it's like maybe working for one of those dentist offices that are connected to a university or something like that. So you're constantly getting traffic. So yeah, those two, Black doctor, and the second part, which is the ideal location for a dentist to work in that's going to produce, outside of small town, that's going to produce the most traffic.
To speak on the Black dentist portion of it, I think not to get too deep. I feel like we have a history in this country, and so almost like you said, of people wanting to potentially find Black dentists. It's not always that. Part of it is that we don't have to worry about them treating us well to some degree. I mean, you still have to look at someone as the individual, not just the color of skin, of course. But I think it's just because we've made so many strides in this country, it just feels good to see someone achieving what this country deems as success. And so it's just inspirational. And so you wouldn't mind going to a Black doctor. But as far as numbers, I mean, as I kind of said earlier, there's over 6,000 African American dentists in the country. That's not a very, very high number at all. So they are hard to find. But sorry, I feel like I'm getting sidetracked a little bit. But as far as what was the second part of your question?
The second part is, what are the ideal locations for an actual dentist to work in? Whether that, especially in a big city, because it seems like it would be something connected to somewhere that's creating high traffic. Like when I was in college, I went to the dentist a lot because of just the way my dental plan was there. And I would assume, since there's a whole bunch of university students who are going to be on these health plans, they're going to continuously go to the university's dentist. So I would assume that that's going to be high traffic, which would also bring a higher salary. So, yeah.
So there's a lot of research. Let's say you're looking to purchase a practice. You can look at the population, how many people are in a certain radius, and you can also look at the amount of dental offices that are also in that radius. And so there's a particular number, not to get too specific, where you can say, oh, we have 5 dental offices, but 20,000 people in this area. That's a great ratio. This may be a good area to open up practice. And so it's very specific. You have to get into that type of detail. If there's 10 dental offices and only 10,000 people in that area, you may not want to do that. And these are just random numbers. These aren't the actual numbers that I'm throwing out. But I would say for a dentist starting out, for me personally, I think it's best to go to a very busy office. Reason being, you get so much hands-on experience. And that's the big thing, just honing your skills and getting that experience. And so I would ask the dentist, if you're looking to join a practice, how many patients would I see a day? And so that would you would indirectly make more, but you would also see more patients as well, helping your experience.
Okay. I forgot to ask about the max. So what was or is the highest salary that you know of in this industry, and what are some of the heights that people can reach?
The highest that I personally know of is that I've heard of. I don't know this person, but I've heard of 700,000 a year for an owner. Yeah, I heard the range from owning is anywhere from like 200,000 to 700,000 a year.
Is
I'm
that
sure there's people who are making higher than that. I'm sorry, what was that?
Is that traffic then? That's just a high traffic location?
It could be the high traffic location. They may own more than one office, which a lot of dentists do as well. So, which would equate to more traffic. Yeah.
Okay. I didn't know if this was like some celebrity situation where I do the celebrity teeth, so
right.
I charge more for their smiles because they're the ones that are going to have to be on the big screen.
Right.
So, I was like, well, I would assume they're probably making millions actually. Because
Probably.
if you're fixing celebrity teeth, they're coming in from hard lives or whatever. It's like, all right, make my teeth look like I'm a superstar. I would think, is that possible? So I remember, this is literally no shade. It's not a secret. I know Cardi B had some issues with her teeth when she first started out. And then all of a sudden she had flawless freaking teeth. So before we leave, we got to get some of that I got to know, because I think I got a good smile. But on my lower stack, my first four, I got a couple struggles in there. People just don't pay attention to it, and I don't care. But if I ever get rich, so you can just rip my teeth out and then put them back in, because yeah.
You can. That's one solution. You can take the teeth out and place dental implants there. Those can look very, very nice, straight and so forth. There's another option, of course, braces. You can straighten them out, or typically what you do in that situation, it's called veneers, which you may have heard of. So you literally shave the front surface of those teeth down, and you place almost a cap on top of them. You cement them on your teeth, and you design those to be perfectly straight, as white as you would like. So your natural tooth, your natural crooked tooth is still underneath that veneer, but you just place almost a faceplate in front of it that makes it appear to be nice and straight and white.
A permanent one.
Permanent,
not that's going to just fade a little bit and slip off at some point in life.
This is permanently bonded on your tooth. Now, with anything, you got to take care. You got to brush and floss. If you don't do that, it's still going to fail. But that's something permanently fixed in your mouth.
Okay, so that's probably what they did with her teeth.
Typically, yeah.
Okay. I don't know if this is an urban legend or if this is true, but I gotta ask since you mentioned that one. I think they said that Lil Wayne, before he went to prison, had like, I think it was gold or whatever. He had one of those grills. He had a grill, long story short. And they said it was permanent, and then they had to remove all of those in order for him to go to jail without having gold, whatever it was, diamonds in his mouth. Was that like, are those permanent teeth that he had in there? Is that true that he really had to get every single tooth taken out and then replaced, or were those?
So my guess, and I don't know this firsthand on what he got, but I think those were veneers. So what they had to do, because they were bonded onto his tooth, they had to go in and cut all of those off. Now, when they cut them off, he still had his natural teeth, but if he took those off and then walked around like that, they would almost look like little vampire teeth or just cones. It wouldn't be appealing at all. So they probably put new veneers on there that did not contain the gold and diamonds. They were just typical veneers. So they looked like regular teeth at that point. If that makes sense, hopefully you could kind of visualize that. So it's almost like a covering, a diamond and gold covering what's on his mouth or on his teeth. He had to have those surgically removed, and they placed a new cover over his teeth that looked more like natural teeth.
Wow. So that's ironic. So the people with the most beautiful smiles from these veneers have some of the most horrendous.
Potentially, yeah. But you know how Hollywood is. Their smiles were probably great for normal people, and they were like, nope, it's not perfect. And they made those changes anyway.
Yeah, touche. Last thing before I allow you to give your final thoughts is the dead. I don't know if it's a dead tooth, but I've seen friends that had like the tooth that may be discolored. I think LeVar Ball has a tooth like that.
Mm-hmm.
What's the deal with that? Because he's rich. Like, I would think that with him having wealth, he could just do something about that tooth.
Yeah, so this is kind of speaking to dental anatomy and physiology. What happens when, let's say you are young and you fell down and you hit your front tooth. You cause trauma to that tooth, so much so that you affected the nerve inside of that tooth, and that tooth actually dies. So because of that injury, your tooth dies. It no longer has that same blood supply. And because of that, the tooth actually changes color over time. So if you see somebody with that dead, you call it the dead tooth, it's really because the tooth is in a sense dead, and it changes color because of that. And so you can fix that in a similar way to the veneer. You can place what you call a crown on top of it, where we just match the shade of the cover to the teeth surrounding it. But LeVar Ball, with all his money, has decided not to do that at this point in time. But yeah, it's usually due to that tooth having some trauma. You may have bumped it or hit it or bit down on something too hard even, and it causes the tooth to change color.
And I respect that. I mean, as much as I crack that joke about getting my teeth fixed, I probably wouldn't, because it's like, it's me. I'm proud of me. I don't really need no alteration. So,
well, I'll say this. You mentioned having the kind of crowding on the bottom. That area, for all patients, that's usually the area where most people are crowded. So that's not abnormal at all for those lower teeth to kind of cross each other to some degree. Now, it is advantageous to have that fixed, but it's very, very common there. So, and the reason I say that, now I'm getting into my dentistry spiel here, but when your teeth are crossing each other, it's a little harder to clean between there. It's harder to floss. It's easier for food and something called calculus to accumulate there. And that can start to interfere with the health of your teeth, your gums, and your bones. So straightening teeth it's not just for appearance, it's also for the health of your teeth as well.
All right. I said that was the last. This is the official last. The veneers, because I know when I got this tooth taken out, I think they said it was like 6 months or however long it needs to heal in order to get an implant put in there. I haven't had an implant placed in there yet. But when it comes to those veneers, they get that. I'm assuming, because you're not just going to send Lil Wayne out there with vampire teeth.
Mm-hmm.
So I'm assuming it's like you shave it down, and in the exact same day, you're putting these things on there. Is that accurate?
So typically what you would do is shave it down day one. Like you said, no celebrity or even, us normal folk, we wouldn't want to walk around with our teeth half shaven off. So we place what we call a temporary crown or temporary bridge on those teeth. So it's something that looks nice, but it's not permanently bonded on those teeth. So you could walk around like that. If you bit down too hard, it might come off. But what we then do is send that mold of your shaven down teeth to a lab, and then they'll bring back the permanent veneer. So I'm sure celebrities can have that turned around within a day. typically it can be up to 2 weeks until that permanent veneer comes back to place on your teeth. So you'll have a temporary veneer on there for 2 weeks, and then you'll get your permanent one.
Okay. Man, this was a freaking fascinating conversation. So much that I've taken from this. I think that the audience did too. We've learned so much. It was so freaking cool. What are your takeaways? What do you want people to remember?
Main thing is this is an amazing profession. You are rewarded financially. You also are rewarded in helping people, keeping people healthy. And you'd be surprised how many patients come in saying like, man, I'm just kind of ashamed of my teeth, but you work with them and you get them back on the right track, and they're so grateful. It kind of, smiles can actually change lives. Unfortunately, we live in somewhat of a shallow society, and even getting a job is easier, unfortunately, if you have a nice smile. People just judge, and so you can really change lives. And if a patient comes in pain and you can get them out of pain, they'll be forever grateful. So there's a lot of rewards that come with this profession. And I would say one big takeaway is start as early as possible. Me being a non-traditional student, I still will say start as early as possible and keep yourself competitive. Try your hardest to keep your grades as high as possible. Like I said, it's not impossible if you don't have straight A's 4.0, but the closer you can be to that, the easier your route will be. So start as early as possible. And even if you're considering it, just stay competitive until you realize you want to go another route. And then, kind of deviate at that point. So.
Okay, great. I'll say this. What I appreciate the most about today is that you have embodied the reason that I was telling people to shut up and have a good day. Like, you embody it in the sense that you are the example of a person who has pride and love in what he does. And for those people who are frankly doing jobs and living lives that lead them down a path of being miserable, at the end of the day, you need to find a way to be proud and love what you do so you can enjoy your life. Otherwise, you're wasting time and you're destroying yourself into out, or hopefully, there's no hope in there at all. There's no out, in to out to in. Neither way is good. But to say that and to see that you are a person who embodies the idea of pride and love and care behind what you do. And I am certain that's reflecting in the actual work that you do. It is an amazing thing. It's a great thing. And it's something that I must stress that, hey, you can wake up on Monday and be happy that it's Monday, opposed to be like, oh, it's another day. So I appreciate your time. I think that you are an amazing example. And I think that this interview was great. So thank you again for your time, and to it ease.
No problem, sir. Talk to you soon. All right.
Yep. Oh my God. Thank God.